Monurol is an antibiotic medication used specifically to treat bladder infections in women, such as acute cystitis or lower urinary tract infections. It works by stopping the growth of bacteria that cause these infections. It's important to note that this medication only treats bacterial infections and will not work for viral infections like the common cold or flu. It's crucial to use Monurol only when it's prescribed for a bacterial infection, as using antibiotics when they are not needed can cause them to not work for future infections. It's also important to mention that Monurol should not be used to treat infections outside the bladder, such as kidney infections. As for the optimal timing and dosage, Monurol should be taken as directed by your healthcare provider, and it's typically taken as a single dose. If you have any concerns or questions about taking Monurol, be sure to consult your healthcare provider for personalized guidance. Before you start taking Monurol, make sure to read the patient information leaflet from your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually 1 packet, sachet, as a single dose. Mix the drug with water before taking it. Pour the contents of 1 packet, sachet, into a half glass, 4 ounces or 120 milliliters, of cold water and stir to dissolve. Do not use warm or hot water. Drink all of the mixture right away. Your symptoms should improve within 2 to 3 days. If you do not get better after 3 days or if you get worse, make sure to inform your doctor. If you experience diarrhea, nausea, headache, vaginal discomfort, or dizziness, it's important to let your doctor know. However, many people using Monurol do not experience serious side effects. It's important to be aware of potential serious side effects, such as vision changes or unusual weakness, and to seek medical attention if you experience them. Additionally, there is a rare risk of a severe intestinal condition caused by a bacteria called C. difficile. If you develop persistent diarrhea, abdominal pain, or notice blood/mucus in your stool, it's important to contact your doctor immediately. In the rare event of a serious allergic reaction, which may include symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek immediate medical help. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, it's important to talk to your doctor or pharmacist. As for the best time to take Monurol, it is usually prescribed as a single dose and can be taken at any time of day. Be sure to follow your doctor's instructions regarding the dosage and frequency. If you have any concerns or questions about taking Monurol, it's important to discuss them with your healthcare provider. Before taking Monurol, make sure to inform your doctor if you have any allergies or if you have kidney disease. If you experience symptoms of a kidney infection, such as pain in your side or lower back, fever, or chills, contact your doctor immediately. It's important to avoid alcohol or marijuana while taking Monurol, as it can make you dizzy. Also, be cautious if you have diabetes or phenylketonuria, as Monurol may contain sugar and/or aspartame. This medication may also affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional if you are using Monurol before getting any immunizations. If you are pregnant or breastfeeding, discuss the risks and benefits of using Monurol with your doctor. And remember to inform your doctor about all the products you are using before having any surgery. When taking Monurol, it's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. It's always a good idea to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs, as well as herbal products. Be sure to consult with your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with Monurol include metoclopramide and probenecid. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. It is recommended to take Monurol at the same time each day for the best results. If someone has taken too much Monurol and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can contact your local poison control center at 1-800-222-1222. In Canada, you can reach out to a provincial poison control center. Symptoms of an overdose may include hearing loss and a metallic taste in the mouth. It's important to remember not to share this medication with others. This medication is prescribed specifically for your current condition, so make sure not to use it later for another infection unless your doctor instructs you to do so. Your doctor may also conduct lab and/or medical tests, such as a urine culture, while you are taking this medication, so be sure to keep all medical and lab appointments. This medication is used to treat a certain bladder infection. It works by stopping the growth of bacteria. This antibiotic treats only bacterial infections. It will not work for viral infections, such as common cold, flu. Unnecessary use or misuse of any antibiotic can lead to its decreased effectiveness. Make sure to store Monurol at room temperature, away from light and moisture. It's important to keep it out of the bathroom and out of reach of children and pets. Remember not to flush Monurol down the toilet or pour it into a drain unless specifically instructed to do so. When it's expired or you no longer need it, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of Monurol. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.